I guess my question to you is going to be, is this going to be the tipping point? Because it's kind of, when I was sitting in the CIO chair, the telehealth uptake was not that, at least the telehealth within the health system was pretty, the telestroke and whatnot was taking off pretty significantly. But the telehealth between a physician and the patient was a very slow uptake, and remote patient monitoring was very hard to get funded.
Yeah.
And so do you think this will be the tipping point that starts to really drive these use cases up?
So I'll start by saying I'm an optimist, and that colors everything that I do. And I think that this will be highly rewarding to organizations that find the right capabilities that meet the regulatory statutes to get paid. From a HealthLoop perspective, if you look over the last 6 years, the first cohort of people that purchased these types of technologies did it from a place of, I want to provide the most outstanding service to patients in my community to differentiate myself and impress my patients. It came from a place of real goodness, right? Because there was no economic benefit to better outcomes at lower costs in their fee-for-service model. And those are the good guys and gals, the ones that are really in it in making the investments for the right reasons. The second major wave of adoption here has been well aligned to the value-based that have significant economic reward for higher quality outcomes at lower costs. And in my opinion, the best and most meaningful models are the bundled payment models. ACOs are just a little bit weak on the edge. Bundles go right into the heart of cost reduction and provide really strong rewards to doctors that manage their patients well. And so in our analysis, we've done a lot of research and publishing on this. A physician in a higher acuity state can save $700 to $1,000 per case, right, by deploying these technologies. So there's real teeth, but in order to feel that reward, it takes real economic analysis, right? I mean, you're looking at, utilization of healthcare services over 90 days for every single patient, and that's not easy to measure and track. And I think now that we look at these new models, it's just sort of the easy button, right? It says to providers, not only is it easy to get paid for this, the payments will not only cover the cost of the technology, but give you a reasonable margin around it. It's the right thing to do. It drives higher quality. And so I do think it's going to act as a lubricant in the marketplace to see adoption really, really come to scale.